kind of talk about pelvic health. I know you kind of talk a little bit about this in your post. So I thought it was so interesting. So what should moms know and be aware of when it comes to their pelvic health? And is this something they should bring up in postpartum visits to the doctor?
You definitely should bring it up. Any concerns, even if, we tell you, oh, that's nothing, it's not abnormal. I still say bring it up. I always say whatever makes you feel better in your intuition and your gut, talk about it. That may stem from the maternal rates that's happening, or it may just stem from, because that should just be common sense. I don't know. People make us feel crazy all the time, but I'm like, if it doesn't feel good, no matter what anyone tells you, tell them to check it out. But pelvic health is really important. I think it's really important to get any type of pelvic health education that you can. I try to give as much as I can, depending on, again, where we are on the spectrum of postpartum with our appointments. But any education with when it comes to pelvic health in the beginning is perfectly 100% should happen. I usually try to give out little PDFs or documents when it comes to, like, when I give them packets and things like that, just have a basic review of what pelvic health is, what you can look out, what the different things are. And then I also have a referral list of some folks that are really local here that took some time in researching. I remember researching for like 2 months of who is the best in all of the mom groups, and then having a personal conversation with some, and then finally found the ones that I felt like, okay, I can do this. I can have it be a referral. Because a lot of moms, I think, don't realize that they talk about how, oh, going to the bathroom is just, it happens at any time now. Or, oh, trying to, intercourse for that first time and I've been cleared. I mean, I'm not healing and nothing to heal. I just don't understand why it's so painful. And that's not, things are different, don't get me wrong, but when it's just not. So I try to really let them know anything that you're feeling to let me know. Once you hit 6 weeks, I still say, how are you recovering? I full blown say, how's sex life? What do I need to? I'll just send you a referral. It's fine. We don't have to talk about it if you don't want to talk about it, like, totally. But just to let you know, we're just going to go ahead and talk about the differences between this, and we're going to go ahead and bring out my pelvic model, and we're going to talk about what your pelvic floor probably looks like right now. Like, we just go into it without them having to really tell me too much, because sometimes it gets a little. But that's what I would want everyone to know, that get education as much as you can. Anyone gives you a referral, totally get your referral. If you can get into any type of pelvic health or pelvic exercises, or in with anyone that's pelvic health specialist or whomever beforehand, please do. I promise you, it's going to be the best decision you ever made. Best decision. That and perinatal mental health. Best decision.